We look at a number of things with ultrasound in fetuses who have spina bifida. We look at the cranial findings of spina bifida, which have helped us increase being able to make the diagnosis. And those cranial findings would include a deformity of the cerebellum, sometimes called the banana sign, but it's related to the Chiari-2 malformation that's nearly always associated with open spinal lesions. We look at the size of the ventricles, whether they have hydrocephalus or not. There's also a common deformity in the front of the calvarium or the skull. It's called the banana sign, and that usually goes away in the second half of the pregnancy. So it's not a serious abnormality. It's just one of the things that's been associated. We also look at the spinal lesion itself, and we determine whether there's a sac covering the exposed nerves, or it's just an open lesion. Sometimes we call that a rachesthesis. That just means there's no covering sac over it, over the defect. And we determine the level, the upper level of the lesion with sonography. We have a few little tricks to determine what is the highest level of the lesion, which seems to be pretty well correlated with motor level of the lesion after birth. There are a few other things that we look for, including not only the size of the cerebral ventricles or hydrocephalus, but the smoothness of contour. Sometimes there are little bumps in the ventricles known as heterotopias. We've gotten pretty good at finding those before birth. We look at whether the legs are moving and whether they're flexing and extending normally, whether there might be a club foot associated with the spina bifida. And finally, we look at the overall health of the pregnancy. So we're going to be looking at the placenta and the cord insertion, the size of the baby, the quantity of amniotic fluid, and the cervical length.